Newsweek magazine states, back injuries are the #1 work-related injury and the leading cause of lost productivity in this country. None of this surprises chronic back pain sufferer and Medicep CEO John Senicero.
I used to be one of those hot dog jocks for snow skiing and severely injured my neck about 20 plus years ago. When you're in that kind of severe pain 24/7 and you find something that gives you relief, I just had to be involved with this.
The relief John Senicero found comes from this exciting new spinal therapeutic motion system, SpineSix.
The machine can move in all 3 cardinal planes and around all 3 axes of motion. And so therefore it had 6 degrees of freedom. So that's how we came up with the name SpineSix.
Dr. Michael Reed, who owns a specialized physical therapy and performance training studio devoted solely to the rehabilitation and prevention of spinal disorders, along with orthopedic surgeon Dr. David Campbell, who specializes in spinal surgery and research, provided critical clinical guidance in the development of SpineSix.
The SpineSix engineering design allows us to take the spine and move it 3-dimensionally as slowly or as quickly as I want to, and in whatever ranges of motion I would like to.
SpineSix is a multiplanar spinal motion system that provides state-of-the-art motion restoring and pain-relieving therapy. In a gentle, continuous motion, SpineSix can move both the cervical and lumbar regions of the spine in 3 planes: side-to-side bending, left and right rotation, and flexion and extension.
We've worked with patients who have been in a car accident and they have acute whiplash symptoms. We've worked with patients who have long-standing degenerative problems and chronic pain because of those changes. We've worked with patients who have had nerve irritation, radiculopathy because of a disc herniation. And we can program the device to move within ranges or not move within ranges depending on a patient's symptoms. So we can make it very, very patient-specific.
Clinical research has shown that this type of controlled motion can significantly accelerate recovery time by decreasing soft tissue stiffness, increasing range of motion, promoting healing of joint surfaces and soft tissue, and preventing scar tissue development.
By being able to, in a controlled fashion, retain movement after the operation is done, I believe that we will see improved outcomes after these motion-sparing operations. And that is the trend in both orthopedic surgery and neurosurgery in this decade.
Here's what patients with a wide variety of neck and back problems have to say about SpineSix.
Feels like it's going in the right range of motion it's supposed to, and just relaxes everything.
So when you get through with it, though, it kind of stretches everything in the back and gives you relief. And I look forward to it.
It's real easy on your body. You don't feel this. You never feel any jerkiness. It actually, you feel, believe it or not, you actually feel very relaxed on the machine. It surprises me because I've been on all kinds of physical therapy machines, and this machine is very smooth, and it just seems to get the job done incredibly.
Stuntman Billy Davies has broken many bones in his daredevil career, including several of the vertebrae in his neck and back.
Even after the injuries you've had, flipping the Jaguar, running the motorcycle off the mountain, doing the ski jump, being a professional water skier, hang gliding accidents, you name it. All that stuff we can see in here.
I got in an accident and where I was run over from behind, and Dr. Campbell put me back together again.
And he's about as close to Evel Knievel as I have in my practice.
After several spinal fracture operations, both Dr. Campbell and Billy Davies credit SpineSix with helping Billy's outstanding post-surgical recovery.
SpineSix, which is a passive therapeutic mobilization system, has value in those spinal operations where we want to regain or retain mobility in the spine. We want to use it in operations where ligaments and muscles are going to remodel and strengthen and need to move during the healing phase.
Dr. Reed's patient, Robert Bill, a former lineman for the University of Notre Dame and the New York Giants, has what he calls the lineman's disease, or spinal stenosis.
Before you come in, you're stiff, because that's just the perils of the disease that I had to my spine.
But through the use of the SpineSix in his physical therapy program, he's found relief from his pain.
So we have patients who have pain, and by moving the spine through a small degree of motion, we can stimulate receptors around the joint, which will block the pain experience. We have patients who are not moving their spines very well because they're fearful of movement, and we can get them into the machine in a decompressed or a non-weight-bearing environment and now move their spine through a physiological range that's normal. They can feel that motion and then assist the machine. So in that way, it's very therapeutic.
Though the cervical and lumbar motion created by SpineSix can be administered by manual mobilization or hands-on therapy, patients like Ginger appreciate the state-of-the-art precision of SpineSix.
It's moving me consistently through a range of motion where I feel relief. I'm not just depending on the strength of the therapist's hands. It can be a little frightening when you're in somebody's hands, whereas this feels, it's very consistent and natural feeling.
For practices in orthopedics and neurosurgery, as well as other medical specialties, pain clinics, and physical therapy facilities, offering patients the use of SpineSix can accomplish many goals. It can help physicians better monitor the care of their patients, from the initial diagnosis through conservative treatment, all the way to post-operative recovery if necessary. It can help a practice bolster its bottom line by generating ancillary income while providing low-risk, highly therapeutic treatments. It enables the clinician to offer an additional non-surgical treatment option delivered entirely in the office. It also enables the clinician to offer a new high-tech therapy to baby boomers who may be looking for an alternative to traditional methods of pain treatment. For the clinical professional, offering SpineSix can also benefit their practice.
From a number of standpoints, it makes a lot of sense to have a device like this in the practice because it saves time, it saves a lot of energy, and it's clinically effective.
Specifically, SpineSix can enhance acute back and neck pain treatment, enhance post-operative recovery, assist in ongoing management of chronic syndromes, and augment performance training programs. SpineSix is aimed at lessening patients' pain while improving their motion and function, thereby enhancing their ability to perform activities of daily living. Unlike many of the passive therapies offered today, SpineSix uses evidence-based principles to productively and safely help patients get back to living their lives without limitations.